The necessary armamentarium.
So I have my blood pressure cuff and my sphygmomanometer.
You will explain the rationale for procedures to patient.
Hi Lindsay, welcome to your appointment today.
Thank you.
To start out today, we're going to start with your vital signs, okay? Just to see what kind of health you're in.
Okay.
Okay?
She will instruct the patient to uncross feet if crossed.
So I'm going to have you uncross your legs for me.
Okay.
And then you can just relax your arm out like that and
Okay.
feel comfortable.
Yes.
Okay.
So as you can see, she positioned the patient in an upright position with arms supported comfortably at the patient's side. Now she will determine the pulse. She will locate the radial artery and apply light pressure with the index and middle fingers. She will monitor the pulse for 30 seconds, noting rate rhythm, volume, and strength. So as you noted, she watched for 30 seconds, just determining the pulse. After 30 seconds, you'll keep your fingers on the radial artery, but you will start to monitor the patient's respirations. This way they are not aware of their breathing pattern and we can get an accurate determination of respiration. As she's observing Lindsay for 30 seconds, she will be noting depth, rhythm, quality, and sound.
Okay.
She will multiply each of the rates by 2 to determine the rate per minute. She will record the rate and any significant characteristics on the health history form. She will also record the rate of respirations on the health history form and verbalize the normal range for pulse, which is 60 to 100, and verbalize the normal range for respirations, which is 14 to 20.
So your pulse today was 64, which is really healthy. Normal is between 60 and 100 for an adult.
Okay.
And your respirations were 18, which is also normal. The range for that is between 14 and 20 breaths per minute. Good.
She will now determine the blood pressure with a manual cuff. She will palpate for the brachial artery and note the location for where to place the stethoscope end piece before putting on the cuff.
Okay. So making sure your legs are still uncrossed, and I'm going to just bring your sleeve up just a little bit for a second. Okay. And then I'm going to palpate for the brachial artery.
She will place the deflated bag of sphygmomanometer in the patient's arm and with the lower edge of the cuff about 1 inch above the antecubital space.
Okay, so this is your antecubital space, kind of like right where your elbow crease is, and we're just going to put that a little bit above that. Okay, good. Okay.
She will locate the radial artery and inflate cuff until radial pulse stops, noting reading, and deflates cuff.
So that stopped about after 1:30.
She will place the stethoscope earpieces in ears. Places the stethoscope end piece over the brachial artery. The end piece should not be under the cuff. She will inflate the cuff 20 to 30 mm of mercury higher than the pressure at which radial pulse disappeared. So Ms. Euler had said that the radial pulse disappeared at 130, so she's going to go 20 to 30 millimeters of mercury higher than that. And she will decrease the pressure slowly, 2 to 3 millimeters of mercury per second. And as she's doing this, she will note the pressure at which the sound is heard with each heartbeat, which would be the systolic pressure, and note the pressure at which the sound becomes muffled and or ceases, which would be the diastolic pressure.
Very good. So your blood pressure was 116 over 76, and healthy is anything less than 120 over 80.
She will record systolic and diastolic pressure on the health history form. She will identify a procedure if blood pressure needs to be taken, which would be to wait 30 seconds. She would also identify methods to increase accuracy with a hard-to-hear blood pressure. She would ask the patient to make a fist and/or raise arm. As you heard, she verbalized normal to the patient, which would be less than 120/80, and also let the patient know of her reading. Then she will verbalize the clinic policies to follow if blood pressure is higher than normal, without consulting her clinic manual.